Well, we took the scientific advice of the Joint Biosecurity Centre. They said these are the countries which could now be moved to the green list. That means that you can travel there. Be aware there are still some things you'll need to do. You'll still need to test when you come home, for example. But it does mean that there's a little bit of relief, as you mentioned in that report, for the travel industry and, of course, for people who wish to get away. But it won't be quite like it was in the 2019 in the old days, but we're a move in a positive direction.
OK, Balearics and Madeira, though, are on the watch list, amongst others, the green watch list. I mean, you more than most will know what it's like to get somewhere and then immediately have to come back and quarantine. Would you book a holiday to Majorca at the moment?
Yeah, so I should just explain the watch list, the green watch list. It means they're on the green list. It means you can go. It's treated like a green list. But we're just being completely open with the data that the scientists have given us and saying there are 1 or 2 concerns. It might mean that we have to perhaps respond quickly on there. So we've said it's the green watch list in order that people can see exactly what we're seeing about it. And I have to say, whoever is booking to go anywhere this summer at all, travel insurance, making sure your flights are changeable, and making sure the accommodation is changeable, all those things are going to be very, very important this particular year. And I think, people will need to weigh up whether that is going to work for them or not.
Yeah, because, I mean, we saw what happened with Portugal, though, didn't we? And that was on the green list, the watch list, and that's flipped in a heartbeat. So that my question again is, would you book a holiday for your family to one of the Balearic Islands at the moment, given that it's on a watch list?
Yeah, so actually they were just on the green list, and the reason we've introduced using this watch list category is to give people a bit more visibility over it if we think things might move quicker. So sadly, Kay, I don't think I've got time at the moment to take a holiday, but if people are in a situation where from next week, from next Wednesday, Thursday, they wanted to get away, then these are the places where you can go for the purposes of holiday. Of course, being aware of all the caveats about the risk of things changing, because in this virus, we know that happens with quite a lot of regularity.
I know you're impossibly busy, and we appreciate you taking the time to join us, but would you book a holiday to Majorca if you were less busy at the moment?
Well, as I say, you're asking me if I was in someone else's shoes. And I'm not. I'm not looking to go on holiday right this moment because I'm rather busy dealing with this and a lot of other transport issues. But so each individual will look at their own situation. I'm not trying to fudge your question. Each individual will look at their own situation, and if people have flexibility, then that obviously is going to be a bit easier this year. If people want, more surety, there are some, although limited number of locations which are just on the green list. They don't have the watch list tag after it. People will have to come to their own decisions, and I think most people realise that after having gone through coronavirus for what is now the second full summer.
I bet Angela Merkel's not your best friend at the moment, is she? She wants all UK visitors to quarantine when they arrive in the EU.
No, look, I understand that. Germany doesn't have the same level of vaccinations as has happened in this country, so they'll be particularly concerned. Each country will have to come to their own decision. A country like Malta, which has a very high level of vaccination, haven't said the same thing, and other European countries will come to their own decisions, and I think I respect that. That's for them to do. But it is different in each country and largely driven by levels of vaccination that they've managed to achieve in each country.
OK, those that are lucky enough to have had 2 jabs, what sort of benefits might they be expecting a little bit further down the road?
Yeah, that's the other thing I flagged up yesterday, which is we've met with the scientists and we've discussed this, and we think that later in the summer, if you've had both vaccinations, then we may well be able to treat a location which is currently an amber in the middle there, list country, as if it were a green list country from the point of view of a double or fully vaccinated individual. So that means you'd be able to come back, take the single test, which is what you have with the green, and not have to quarantine. We need more information and data on this, and there are some difficult issues to resolve as well with regard to, what happens, for example, for children, for those who can't be vaccinated, and of course giving everybody the opportunity to have those vaccinations. And if you're over 18 now, please book, please go and have your first jab and get the second one when you're called. So there are a number of things that needs to happen first, but I thought it was right to give people an indication of our sort of direction of travel, what we were seeing and what we think might be possible. I'll say more about that next month.
OK, I mean, I'm guessing that it would be perfect to dovetail that into the 19th of July Terminus Day, wouldn't it?
Well, I think it's unfortunately a bit more complicated than that. For example, we've got UK vaccination certificates, and if you download the regular NHS app, that's not the COVID one that you use to check in. It's just the normal NHS app. It's already capable of displaying your vaccine certificate. It will show your vaccine status. So that's easy for people who have UK vaccinations. What do you do, for example, for a country that doesn't have any indication of vaccination status? And I'm thinking here of locations where, for example, the United States, where I think they probably have 50 different systems, and much of which is paper-based in different states. So there are complications in terms of how you would accept other people's vaccination certification. And those are the things that we'll be working through, which I imagine will take longer than the 19th of July, particularly for people travelling from other countries here. Yeah. So we'll probably focus in phase one on UK vaccinated people who've been double vaccinated and what that means for their travel into amber areas. OK,
so it's looking more like August, really, isn't it?
Well, as I say, you're preempting something which I just don't know the answer to, and I want to be completely upfront with you about that, not least because the Joint Committee on Vaccines and Immunisations have yet to opine on whether children should or shouldn't have vaccinations, for example. And that's one of the very big areas, is what do you do if children are not going to be getting vaccinations? So there's quite a lot of interrelated and complicated decisions to make on this. I thought it was right just to give people an indication, and particularly the travel sector an indication, that we are looking at this, we are working with the scientists on this, and we're thinking about how we could best apply it. And so just in the interest of being transparent about it, we're telling people what we're thinking about, and I'll come back next month and be able to say more on it.
OK, Silverstone planning a capacity crowd for the British Grand Prix. Lewis Hamilton says he's worried about his fans that are in the stands. Why is he wrong to worry?
Well, I think I just saw that story before I came on. I think that the most important thing, as with all of these, this experimental program where we've been seeing numbers of crowds being able to attend events, we need to follow the science and see what that's saying. So far, as I understand it, so good. There are tests done before on these programs, experimental programs. There are tests done a period afterwards to see what's happening, and depending on the environment, what's happening. So, for example, obviously we know outdoor events are much better than indoor events, for example, from the point of view of not spreading the virus. So my simple answer is, let's follow the science. Let's see what that says, and then be able to open events as per the opportunities to do so. Obviously, we all want to get back to the world we used to live in. We've got to do so safely.
OK, got it. So he needs to worry not. 19th of July, George Eustace, when he was on the show the other day, and I think Rishi Sunak as well, has said that they're going to ditch their mask. Will you be doing the same?
Well, I should say, actually, the government's carrying out a review of what to do with what are called the non-pharmaceutical measures. That's things like social distancing, things like wearing masks and the like. So I'm going to wait to sort of get the outcome of that, because, again, it will be based on scientific information before I sort of jump to conclusions. Obviously, we're all desperate to sort of ditch the masks, but I think we want to wait for the science first before making a decision.
But there is no legal compunction to wear a mask, is there, after the 19th of July, which is why he says he's... certainly George Eustace, who I interviewed, said absolutely it's gone.
Yeah, well, look, as I say, the whole point of setting up these reviews, following the scientific data, is to be able to advise people. As somebody I saw in the package you paid just before I came on very wisely said, let's wait and see what the technical and scientific advice is. Let's wait to see what the government recommends, and then we'll be able to make a decision. There are people who say they'll feel more comfortable, for example, on transport if they keep the mask on. Other people say it should be removed. What I want to do is see what the science says, and make sure that we can all go about our business as safely as possible.
Bit more cautious then. Now, I need to ask you about the Sun story this morning about the Health Secretary, Matt Hancock. What are the rules about appointing friends to a position at the heart of government which may give them special access?
Well, look, first of all, I think the actual issue is an entirely personal issue for Matt Hancock. In terms of rules, anyone who's been appointed has to go through an incredibly rigorous process in government. So whatever the rules are, the rules will have to be followed. There are no shortcutting. That, as anyone who's had anything to do with the appointment system in the civil service knows, there are very strict rules in place.
Yeah, I mean, we spoke to the Department of Health this morning. They say this appointment was made in the usual way and followed correct procedure. What exactly?
And also some time ago. I don't think it's a recent
procedure.
So it depends on the specific role, but people have to go through usually an interview process which involves an independent panel. Recommendations are then made to ministers. Depending on the type of role, you'll get something called appointable or non-appointable list, and then you make a decision based on the qualifications of the individual. So I don't think I think it's a bit of a red herring in this case. I think it's really a personal story, and it's not. So I don't intend to comment on somebody else's personal life.
Didn't ask you to. I was just asking you about what the rules were as far as appointing people was concerned. And I suppose I would ask you finally, would you be comfortable appointing a former university friend into your office?
Well, I would only ever appoint somebody who's qualified for the role. As I understand it, this individual was more than qualified for the role of advice being provided. As I say, beyond that, I fear you tempt me into commenting on personal matters. And the health sec's been working very hard rolling out this vaccine program, and so I'll leave it there.